Dr. Tim English. I'm a family physician at Family Medicine and Wellness Clinic, Hot Springs, Arkansas. You know, the pandemic is, in my 35 years of medicine, has been a very unique situation, probably the most stressed for me, but all physicians, nurses, respiratory therapists, ER physicians, it's put a very big strain on our healthcare delivery system, not just here, but everywhere. What we have seen in our community is similar to what we're seeing across the country. The first wave that we had with this was devastating, but we were able to pull through it. The very high-risk patients that I've seen and in my practice that have died have been mainly diabetics and heart patients. Those are the patients I really have tried to really focus on getting the vaccine above everyone else, and most of my patients have done it. If you've had a family member, if you've had a friend that has died from this, you know what I'm talking about. And once they're in the hospital, there's a high risk. If they go on the ventilator, there's a very strong chance they're not going to survive. So it's imperative that we get vaccinated. This is not a thing to take lightly. You can't depend on everyone else to get vaccinated and think that that's going to take care of you. We all need to get vaccinated to, number one, protect ourselves, protect our loved ones. And even if you're not high risk, the only way that we're going to wipe this virus out is to be immunized so it can't continue to mutate. As far as the second round that we're seeing now with the Delta mutation is much more contagious. I read an article the other day where they said the viral load, the amount of virus in your nose, is 1,000 times more prominent than it was in the previous. That's why it's so contagious. If you have had COVID and you think that you're protected, you're partially protected, but not totally against this virus. We have had, since our snowstorm, I had not seen any patients with COVID up until about 3 weeks ago or 4 weeks ago. And I've seen immunized patients who have the disease. But here's the bottom line. If you've been immunized, your risk of getting the new virus is only about 20-25%. You only have about a 10% chance of being hospitalized. If you've not been vaccinated, you have a much higher risk of both. If you have questions about getting a vaccine, your local pharmacist most likely has it. We prefer that you get the 2-shot vaccine because it has a higher success rate. The Pfizer and Moderna vaccines are 90-95% effective. The Johnson & Johnson, which is a 1-shot vaccine, is only about 70% effective. So all you have to do is call a pharmacy. You don't even have to call your physician. If you think that you may have contacted or have symptoms of COVID, call your physician's office. I'm sure they handle it like we do. Our nurses screen those calls. Anyone with a cold gets asked several questions, and if we have a concern, we have you come to our office, sit in your car, we come out to your car and screen you, and within 15 minutes we know if you're infected. If you are infected, you're over 65 and or high risk, there is an option to have infusions of the monoclonal antibody. National Park offers it Monday, Wednesday, Fridays. All it takes is us to fill out a form, fax it over. It's an hour procedure, there's low risk, and within 48 hours, most people tell me they're feeling much better. I've had several diabetics escape hospitalization doing that, and I'm a very big proponent of the monoclonal antibody infusion. If I got it, I'm 65, I would definitely have it.